My name is Jerry Gormley from Queen's University Belfast, and on behalf of my co-authors I'd like to introduce you to our paper that has been published in the British Journal of Dermatology. The aim of this project was to develop potential new educational methods to best prepare our medical students to really understand what it might be like for an individual to receive a diagnosis of a melanoma. Despite more patients being diagnosed and living with melanoma, medical students are increasingly having fewer opportunities to interact with this important group of patients. In terms of education methods, simulation is an important way that we can allow our students to experience a variety of clinical situations. We reasoned that if we could temporarily simulate what it might be like to have a melanoma, would this allow our students to gain a deeper insight to what it might be like to have a melanoma, but also for them to critically reflect how best they may interact with these patients in the future. We used temporary transfer tattoo technology to recreate a highly realistic melanoma simulation. This is where we applied the image of a histologically proven melanoma on a transfer tattoo, and this allowed individuals to apply this to their skin. In addition to this, in our study, we used this as an immersive simulation experience where the individuals also listened to the audio account, the narrative of an actual patient sharing their experience of what it was like to receive the diagnosis of the melanoma, the image that they actually were wearing on their arm. The medical students then went about their day interacting with others and really reflecting what it might be like to have this melanoma diagnosis. They recorded their responses, their thoughts, their experience on an audio diary, both during that day, but also in an interview afterwards and 3 months later. We analysed this data using a qualitative approach called phenomenology, and this provided us with deep insights to what those students experienced, their lived experiences during this simulation immersion. Our analysis yielded interesting and very insightful results. Firstly, in no way could we ever truly recreate or simulate what it may be like to receive a diagnosis of melanoma. However, this simulation activity did provide some modest insights, but important insights to patients' experiences of receiving such a diagnosis. The fact that the image in the tattoo was a true representation of an actual patient's melanoma really heightened the realism for the students in this study. Being able to co-emerge into their day-to-day activities further reinforced the experience and the realism. It opened up some insights to what it might be like to receive such a diagnosis and the impact that this can have on that individual's life world. At no stage did the simulation experience produce any negative impact. In fact, quite the opposite. Students used this as a point to critically reflect on how best they would interact, be empathetic to patients in the future, allowing them and encouraging them to express their feelings and worries and concerns, to really consider the person, the individual behind the melanoma lesion. Overall, we believe that this relatively novel and inexpensive simulation activity can afford healthcare professional students some insights and an embodied experience of what it might be like to experience a diagnosis of melanoma. Such a learning experience triggered our students to critically reflect on how best to approach and to care for these individuals in the future. We do hope you enjoy reading our paper.